Depending on the person's needs, besides healthy diet and exercise, what are supplemental vitamins, minerals, or peptides you would recommend while on TRT that wouldn't hurt to add?
So every man, woman, and child in America seems to be vitamin D3 deficient. So I do recommend at least 5,000 IUs of vitamin D3 per day. It is one of our 4 fat-soluble vitamins, so you do want to consume it with a fatty meal. You can have eggs in the morning or anything of the sort, so it absorbs better. For those that are not contraindicated to vitamin K2, if you're not on a blood thinner like warfarin, for example, then you should take your D3 with 200 micrograms of K2 combined. It does help absorption as well, and it helps to keep the calcium out of your blood and in your bones. So we have our D, we have our K. Any nitric oxide booster, I'm a big fan of L-citrulline. You couple that up with tadalafil, again, as long as you're not hypotensive or taking any antihypertensive drugs. L-citrulline, I'm a big fan. I use about 3 grams a day myself. Vitamin C, 2 to 3 grams a day, I'm a fan of. Vitamin A, 10,000 IUs a day. These are all basics, and these are the type of nutrients that you really are not going to get sufficient levels of in a multivitamin. Multivitamins are great, but they kind of help to make, expensive urine. They don't really absorb very well because they try to pack too much into too little. And, unless you're taking, multivitamin where serving size is like 4 or 5 capsules, it's very difficult to take a 1 a day and expect to get everything you need. If you look at the nutritional list on them, the RDAs, or the recommended daily allowances, a lot of those were designed back in the 1950s, and they are not applicable today to the way we live and our needs and our deficiencies, because back then deficiencies were not as prevalent as they are now. Quality of food was different. The level of activity and exercise was different. With modern technology, we're a very sedentary society. Our food contains very, very little or to no nutrients whatsoever. So we don't eat the same way. Okay. There was no, Chick-fil-A drive-through back then. And people used to actually eat garden fresh fruit and animals. And the deficiencies that we encounter today do require higher levels of nutrients. So multivitamins, kind of flawed. But again, vitamin C, vitamin D3, vitamin K2, vitamin A, basic essentials, some amino acids. If you're eating quality meats, you should get sufficient proteins and amino acids, but some of the other aminos like L-citrulline, if you're someone that exercises, really helps. And, L-citrulline helps with erectile function for men as well, being a good vasodilator.
Mm-hmm. And John asks, are there any downsides to taking vitamin K2?
Yes, it's contraindicated in patients on Coumadin because it does negate the anticoagulative effect of the medication. So if you have AFib or if you've had stents, or check with your healthcare provider who prescribed you your blood thinners if K2 is contraindicated before you take it.